Good morning, everyone. I'm going to go ahead and go over a few things before we get started with today's Board of Health meeting. We'd like to thank you for joining us via Zoom. My name is Jeff Wren. I'm the moderator for Southwest District Health. I will be your live stream moderator for today, answering any and all questions you may have in the chat. You may also direct your questions to Public Health Idaho at phd3.idaho.gov at any time. Please be mindful of your conduct in today's meeting, as this is being recorded and will be made available for later viewing at the Southwest District Health YouTube channel, youtube.com/Southwest District Health. For those zooming in, please direct your virtual session Zoom-related comments or concerns to myself. If you are not directly participating in the discussion during the meeting, please mute your microphone and turn off your video feed to preserve bandwidth on today's call, unless you are presenting or contributing. If you are in person in the room here at Southwest District Health, please unmute the button on the mic, identify yourself prior to speaking, and speak clearly so we get the best audio possible. You may need to adjust your microphone to ensure it's pointing directly at you and pull it a little bit closer. When you're not speaking, please mute your microphone to prevent any kind of feedback. And if you have any cellular capable devices such as cell phones, tablets, keep away from the microphone, as there can be some interference that are caused by those. When it's ready, I'll now turn it over to the chairman, Commissioner Abasteri, to call today's meeting to order. Thank you.
This time we will have to hold off. We need one more board member before we have a quorum. So we will wait until another board member shows up. Thank you.
Thank you, sir.
Okay, at this time we do have a quorum, so I will be calling the meeting to order. I would ask everyone to please rise. I'll have to see what actually time it is. 9:04. So I will do a roll call at this time. Here. Brian Elliott is absent. Commissioner Purdy. Dr. Summers. Here. Commissioner Brooks. Present. I am present. We have a quorum, so thank everyone for being here today. This time, I would ask for, and it can only be informational, Any requests for additional agenda items? Hearing none, I would ask an approval, and at which our attorney told us that the agenda's already been, already here, it's already done. Want to approve the agenda, that's fine.
Make a motion to approve the agenda as presented.
Summers, second.
Been moved and seconded to approve the agenda as presented. All those in favor?
Aye.
Aye.
Motion carries. And at this time, we will go into public comment. So is there anyone for the public, either on Zoom or the building here, that would like to speak?
Test, test.
I can't walk around a lot. My name is Heidi Smith, and again, I thank you for the opportunity to comment. I'm here again basically as a follow-up on your COVID hot wash from last month. It's taken me a little time to digest what I've heard, and I did send material to Mr. Dickman and to Tina on some follow-up. What I've handed out to you is an MD that I work with who does a lot of who has been following the literature. These are things that she pulled out in addition to the items I shared. These are this is information on vitamin D primarily, but also a little bit on zinc and some other things that were available prior to the time that Southwest Health District printed the public advisory that you did, which basically stated that there was no significant evidence of the mitigating use of vitamin D in the face of infection, and in particular for COVID. As I've thought about this over the last month, my comment is that to put up a publication that says that there is no evidence when there is a lot of pressure on the public saying that there is evidence actually drives the public to follow things that may not be healthy. And I think one point that was made in the flyer is that you can overdose these supplements. What happens when you put up something that says there's no evidence is you get a kind of a binary, an either or. Either I'm going to believe that or I'm not going to believe that, and you basically build a wall with the public where they feel, because they see evidence, that they're not getting the straight story, and because they know there's evidence, but they're also not necessarily in a position to judge how that evidence should be used in their own situation. And I would submit that it would have been far better, and it might be something you might want to consider still doing, to say to the public, yes, these things have value, and I don't know if the health district offers vitamin D testing, but I would submit that for then it would have been a better approach, and it would still be a better approach following on into the future to offer testing for vitamin D and for other nutrients so that you can properly advise people. Do you need a supplement? I mean, are you personally deficient? We know, for instance, that the vast majority of people who live above the 35th parallel are deficient in vitamin D. We know, and we've known since long before COVID, that vitamin D is essential in order to mount an immune response to anything. And as such, I think you would build far more trust with the public if you would say, yes, we know this. Let's test you. Let's see where you are. Are you one of those people that may have enough? You're a farmer and you're out there day in and day out and you're getting enough sunshine, and gee, you're in the normal range. Or no, you're in a nursing home and you never see sunshine, and your level is just in the pits. So far better to say, yes, there is merit in this. Let's test you. Let's see where you are. Let's help to get you at the right level and to prevent you from overdosing. So I hope that makes sense as a constructive comment as to how this should have been happened and should happen in the future. And so I would hope that maybe testing for some of these nutrients might be something that you might add to your services. That said, I would like to see, and I mentioned this in my correspondence to Colt and to Katrina. I came away from that hot wash, and I appreciate the fact that you did let me in as a member of the public. I think that was very important for you to have that transparency. I did come away with the feeling that as a group of commissioners, you guys did strive to do the best you could in a bad circumstance. That said, I would also comment that that it's important for medical personnel to really be literature sleuths in these situations, because I cannot expect, and the public cannot expect, lay commissioners to know how to immediately do in-depth literature searches to say this might help. I know as a practicing veterinarian, and for 20 years, and I brought this up last month, when patients are dying, you don't have the luxury to wait 2 years for a study. You've got to start looking at literature and see what people are doing immediately. Look back on general literature in terms of nutritional support for immune health, etc. You've got to be doing that kind of stuff. And so I think that's an important take-home, to be able to get these things dug out so that lay people who are looking after the interests of their constituents have that knowledge. And I hope that also is a constructive comment for going forward in how to search literature and how to do the best by your people that are depending on you for advice. So with that, I think that's my wrap-up for my comments from the COVID hot wash.
Thank you very much. Appreciate it.
Dr. Summers, and I absolutely agree. Vitamin D is associated with poor outcomes if it's low. The problem is there's been several studies that have shown that if you give patients who are vitamin D at the time of admission to the hospital, no improvement. And the take home from my standpoint is that vitamin D needs to be weeks, months in advance. And everybody should be on vitamin D. I think the literature is pretty complete that pretty much everybody, and I don't care if they live in Florida or if they live in Idaho, they need to be on vitamin D. And I have yet to see anybody vitamin D toxic.
If I could respond to that, I do agree, Dr. Summers, that pretty much by definition we're deficient. And but there again, when the public reads that flyer that says there's no evidence that vitamin D helps, you're right in a treatment situation. Now that's not true for zinc. There's literature out that zinc is helpful in a treatment situation, but it does take vitamin D quite a while to boot up to help you out. But there again, knowing that at the outset of a pandemic, the responsibility of this board should have been you're apt to be vitamin D deficient. Before you ever get exposed to this, let's look at your vitamin D level and get you on it. As far as toxicity, I can speak from personal experience that I started out at 5,000 units and that I got hypercalcemic. I dropped back to 2,000 units. I mean, I didn't have any clinical symptoms of that. I know because I followed my blood work. But at 2,000, life is great. I also know from personal experience that having put a ward in a nursing home on it at the outset, that I think that I did have her tested when she got COVID, and which she did, and she was at 65, which is normal. And I do believe that when I was told by St. Al's not to expect her to walk out of the hospital, when she did walk out 3 days later so we could finally get some ivermectin into her, after which she had a full recovery, I do credit having her on vitamin D to the fact that she got through that initial. that initial push so that we had a patient we could still treat. That's what we call a one-rat study, but still, those are repeated all over the place, and so I guess that would be my response, is that still it behooves this board to be able to say from the outset, this isn't a treatment, but it's something you'd better be on. You'd better, rather than putting out what was put out that said there's no evidence, because that literally just puts up a wall, and people go, well, you guys just aren't credible, and that's not fair either. So, saying thank you.
Thank you very much. Appreciate it. Any other public? Okay, thank you. Any other on that? Okay, then we'll move on to Jim County Board of Health Representative confirmation.
Well, you pretty much just gave the update. Brian Elliott's been confirmed. Unfortunately, he wasn't able to be here today, but that's the update.
Okay, then I would open it up for discussion from the board members if there's anything the board wishes to discuss, topics or whatever.
I just wanted to distribute, we've talked about this a few times, and so I just wanted to distribute testimony from Dixon Seth Brown, who is from Jim County, but he is a medic at Camp Pendleton, almost, I think, 19 years in the military in the medical part of it. So I just wanted y'all to have this because it talks a lot about what's going on there, and the vaccine and COVID. It goes through the entire scenario, and it's pretty, it's very detailed and very well done, so I wanted y'all to have that. And then I didn't make copies of this, but this is the 9 pages of adverse events from the vaccine that is from Pfizer. So there's 9 pages of it. So if you guys want to make copies of that, you can pass that to Nikki, and she can, but I wanted y'all to have that, so you knew.
For discussion from the board? Okay, then we will move on. And then I would ask, has everybody had a chance to go through the minutes? I would ask for an approval of the minutes, March 28th meeting.
Commissioner Haynes, I'll make a motion to approve the minutes as presented.
Summer, second.
Then moved and seconded that we approve the March 28th minutes as presented. All those in favor?
Aye.
Aye.
Aye. Any opposed? Motion carries. We will move on to the introduction of new employees for the administrators.
I just have one new employee to introduce to you. Her name is Cassidy. I'll let her introduce herself.
Hi, my name's Cassidy. I'm originally from Northern California, but I spent the last 4 years in Reno, Nevada. I did my undergrad there, and then I've been in Boise for the last year. I attended Idaho State University to get my master's there and graduated their dietetic internship master's program. So now I am the new dietitian here, and I'm really looking forward to my time here to be on the prevention side of nutrition and work with all the amazing people here. Thank you.
Very much, and welcome to the Southwest District Health. Okay, this time we will go on to Troy with the March 2023 expenditure and revenue report.
Hi, good morning, everyone. Can you hear you? You'll turn to the expenditure portion of your packets. You'll see this month's expenditure report, which is for March. We kind of carried over what we did last month, where we split out the crisis center. We're going to do a little bit more work for next month. We're going to actually pull out the youth crisis and the adult crisis, so you'll get those specific splits. So we'll start with the district portion, which is the main portion of the budget. So you can see from the upper right-hand corner that our target is 75% as we get through the end of March. You can see our net revenues versus net income is a little above where it should be, and our expenditures are for this month are, you can see that the negative amount, what that means is there were 3 pay periods in March, and so the revenue and expenditures, the expenditures were a little higher than the revenue based on that 3rd pay period. If you look down in the revenue section, you can see that county contributions are right on target. Contract revenue is still down a little bit, and that some programs I think are still working on getting activities done. We have interest is pretty close. It's going to be higher than I'd thought, but it's good. It's good news. And other revenue is really close. We're at $190,273. That is anticipated to go up as we get closer. All right, so then if we move into the expenditure section, you can see that personnel is getting closer to being on track. We're at 73%. Operating is still down, again, related to some of those contractual activities that are happening closer to the end of the year. Capital outlay is still low. We did receive some invoices, so some of that hopefully will tick up by the end of the fiscal, and trustee and benefits are in the same boat where we have a lot of payments to subrecipients that are anticipated to happen near the end. And just as and you guys may all be aware as well, just as an FYI, as we shift, and you guys all know the state is looming, their ERP to looming to Luma. So Luma is the new ERP that's through the state system, so we've been working really hard to get us converted over into the new ERP. Some of the reporting is definitely going to change. You'll kind of see style of reports probably for next fiscal year with go live July 1. There is a chance that based on the entire state shifting to this process, and our largest pass-through agency is the Department of Health and Welfare. They're kind of in the middle. Also, some of our sub-grant revenues may drop in July as everyone figures out how to do billing and how to get revenues coming in August. But a bumpy month for July, just because really heavy learning curve, not just for my team, but for the entire district as folks learn how to do their timesheets, and so all of that will be forthcoming. But I say that to say that a lot of what's happening with expenditures, on our end, we're working to get as much paid as we can in May and June, so that frees up some flexibility for July. I think the Department of Health and Welfare and some of our other grant holders are doing the same. And so on that vein, I just wanted to also let you know, Nikki doesn't know this yet, but we just received our payment for one of the state-funded youth grant activities. So because these are state general funds, the state is working to clear their budget as well with Luma coming in, and so we received our full payment up front today. So that'll be sitting in our committed funds, or restricted funds, pardon me, going forward. And the other grant should do that also by the end of the large balances living inside of the youth and adult, not just the youth crisis center function. You'll see those as we move on to the budget. You won't see those numbers today because we just received the check, but by the time we present the balances of the fiscal year. And I've also worked with SEO just yesterday to help identify, because the crisis center, there's just a ton of money sitting in there. I've worked with SEO as of yesterday to set up separate funds so that these funds will no longer, they'll live in kind of our realm, but they're separated now outside of our main fund. So we'll have a little bit more segregation as far as those funds being not as commingled, which is really difficult to pull monies out in those environments when they're commingled. That'll help us as we go into LUMA. Questions so far on the district portion?
What is LUMA?
Oh, I'm sorry, I didn't even tell you that. I'm sorry. So LUMA is, they call it an ERP. It's an enterprise resource. Essentially, it is the entire state is shifting the way it does accounting and the way it does. There's really essentially two phases. There's a finance phase, which handles all the accounting, the treasury, and how we do reporting and auditing is through this financial system. The other side is what they call GHR, so this is another module inside of LUMA. And the state calls it LUMA, but the guts behind it is through a system or Infor Suite. So the Infor Suite is a cloud-based accounting system that really just provides us greater tools for reporting. We don't have to wait a week or a night for transactions to happen. They happen immediately, and we get to pull those reports a lot quicker. I think it's going to be very robust, and as being still connected to the state treasury, the state has allowed us to use this. So it's just part of our ongoing connection to them. So I think it's going to be really, really a good thing. It's just really a steep learning curve. So those always make that challenging.
I'll use my microphone. I mentioned that the system that we're currently on, that the whole state uses, is about 30 or 40 years old. I think it was built in the 90s or something like that by, I think, the state. So this is obviously a third-party vendor bringing the whole state up with the times. And Commissioner Abasteri asked if this was mandatory prior to House Bill 316. I guess you'd say yes, because we were pretty connected to the state. Now we are through an agreement to continue to use the State Controller's Office and their financial kind of platform. So we will be making this migration with them. And I guess we'll see on the other side once we see how it works for us and the cost, because we still don't know what the cost is going to be to the district, which is something that all the districts had concern about. We'll see if we're going to ride this out and stay with them long term. But there's definitely been an investment of our finance and purchasing and HR team because all of those functions will be automated for them. And then, of course, all the staff who interface with purchasing and timesheets and
the state wasn't upgrading, their program wasn't able. They were still able to utilize it. They just went at a newer system because they were updated. The old system was still serviceable. Okay, because, you know, on some of the stuff in the past, they've had to because they were so serviceable. Hardware or software or anything to... Okay, all right. So eventually it will be mandatory. Some different program. Cost us money.
Yeah, Commissioner Abasteri, that is correct. I think the long-term viability of the current legacy system is really it's on its last legs. I think some of the attributes and some of the functions that they want to incorporate going forward are just not available. The current system is familiar, but it's a green screen. It looks like somebody went through and did those little, counted like four, put a dot here, put a dot there, put a dot there, and it creates the word stars. So it is, you know, to Nikki's point, it is well over 30 years old, and so it is time for the state to upgrade and for us to stay connected to the state through that agreement. It is for them, the changeover wasn't mandatory, but it does create an environment where they can, unless they do something, other states and it's moving to a cloud-based system. 5-year-old, so that is where we're, and I think it's gone well. It is almost 3 years in the making, and so far I think this time with Go Live it's going to actually happen. Like our second or third Go Live.
Well, we'll just hang on because some of the other transitioned have not been caused numerous problems for local counties and cities to help fix the problems. You know, it might not be all a bowl of cherries.
Commissioner Adversary, your point is well taken, and it hasn't been a bowl of cherries so far, that's for sure. The reason I wanted to bring it up today is because I just wanted to make sure that you all were aware of some of the implications that might happen in the next couple months as we work through really transitioning. I'm expecting July to be super bumpy. So I appreciate that. And I think you're absolutely right, Commissioner Adversary. There is an environment where this could go spectacularly wrong, but I'm very, very hopeful. We have really worked hard to kind of tie all the pieces together, and I'm hoping it's actually going to be a really good for us. That is the marketing. Got my fingers crossed. All right, so if there's no more questions on the main district portion, we'll move to the Crisis Center activity, which is on page 2. Again, you can see, based on what we have, the bulk of the activity for the Crisis Center activity and revenues really comes in contract revenue. These are really billings that we've done so far to the Department of Juvenile Corrections. For the grant specific to those activities. We have received in advance some monies from the cities for the youth crisis. The board has approved $500,000 to use of the opioid settlement, so that is still sitting out there. And then we're using the $28,571 in committed reserve, which was some of the crisis center COVID monies that were sent by the state. Got permission to use. Those are also in. We are at 78% of personnel, which is pretty close. Operating is still pretty low. Again, I think as those, working on partners.
I'll just chime in really quick, Troy. That will be an update later in the agenda. On the vendors, and then I know we have some unexpected delays with the Youth Crisis Center from the state, and Cass will probably provide a brief update on that later. Thank you.
So as you can see, our expenditures are still at 9%, particularly in for the bulk of those costs for the on the Youth Crisis Center activity. Again, next month I will split those two, so you'll get to crisis activity and.
That'd be great. Questions? Go ahead. committee, I would ask Adams here. The Canyon County Community Health Action.
Pulling up some slides here. While he's doing that, good morning. My name's Daniel Adams, a senior health education specialist on the community health team here at Southwest District Health. I coordinate the physical activity and nutrition program, which includes our Fit and Fall Proof exercise classes, the diabetes, heart disease, and stroke prevention program, and then I also co-facilitate the Community Health Action Team for Canyon County, the Caldwell Health Coalition. So you may remember Emily Strubar, program manager for the Community Resilience section of the Community Health Team, provided an overview of the chats presented on the Payette County Health Action Team, or the PCHAT, back in February. So I'm going to skip a few slides here that were in your packet and just quickly provide a recap of what she covered in that overview. So there are, and Sharon's doing the slide, so Sharon, if you could go to the 5th slide while I'm covering this part here, but there are chats in each of the 6 counties within the district. They meet regularly to identify health needs and opportunities in the community, and then identify actions to improve identified health needs, and that's with input from residents, elected officials, healthcare organizations, schools, and really any organization interested in the health of the community. The chats are a way for us as a health district to provide some of the essential services of public health, like mobilizing communities and partnerships, enabling, enabling equitable access, and then building community infrastructure for health. So just kind of some historical background on the Caldwell Health Coalition. It was formed back in 2018 as part of the Well Connected Communities National Health Initiative with the Cooperative Extensions, National 4-H Council, and support from the Robert Wood Johnson Foundation. So the initiative really works on building diverse, multi-generational, so we're looking at including youth and adults in these coalitions, cross-sector, so we're, like I mentioned, our membership is made up of organizations, community members from across the communities, and then recognizing and addressing systemic health inequities within those communities. So essentially what we're trying to do is forge some of those connections, build capacity, and then take action in our communities so that we can ensure the lifelong health and well-being of those that are within the reach of the community. So the University of Idaho Extension established coalitions in 3 different communities across the state as part of the initiative. So there's one in Preston over in Franklin County, and then there's 2 here in our region, one in Marsing and the other in Caldwell. So you might be wondering why it's not the Canyon County Community Health Action Team. That was because that was an effort that was already existing with the Caldwell Health Coalition. So rather than duplicating efforts, we've joined with that effort that was started by the University of Idaho Extension Office. And we serve as an additional backbone organization and co-facilitators for those respective community health action teams. So, according to that next slide there, the coalition really is trying to address 6 pillars of health that you can see there. So access to healthcare, improving food access, addressing mental health, housing options, supporting underserved micro neighborhoods and built environment, and with equity is that foundation. The pillars were identified through community health needs assessments and input from community partners that participate in the coalition. And you might recall from Emily's presentation, there was a community health needs assessment that was completed this past summer. That will be published in June, and we expect that as a coalition, we'll use that data to inform our direction as we're kind of moving forward here. So next slide, please. Sure. They're not listed as a member, so it's hard to fit all of them. So we have, and I'll get to that maybe here in a second. But if you still have a question, we can come back to that. Yeah. So the coalition meets regularly on the third Tuesday of each month, and it's open to all community members. Currently we have over 40 adult and youth members. Our members represent over 20 community organizations, many of which you could see on the slide there, and then that are all working to drive health action in Caldwell. So West Valley is a participant within the coalition. Some of that membership kind of ebbs and flows in terms of who is currently or actively participating in the coalition. Does that answer your question there? Okay, yep, thank you. Yeah. Let's see, next slide here. So the coalition has been involved in several projects since forming. The first project that you see here was a walkability initiative. So we were looking at walkability around Caldwell schools, and kind of a definition of sorts. So walkability is a measure of how friendly an area is to walking, and it's focused primarily on safety. So for the Van Buren Elementary project, we purchased new crosswalk signs that were funded by St. Luke's, and we worked with the City of Caldwell's Traffic Commission to expand the school zone. And then during October, with that Walk to School Day, we passed out reflectors, the Treasure Valley Safe Routes to Schools, and Safe Walking bookmarks to Van Buren students to help keep them safe as they're walking to school. One of the other projects related to improving food access was a survey that we did for Cliffs Market, and that was to help assess the viability of operating the market under a co-op model, which they ended up not doing, but that was a way for them to try that was feasible for them to do. In 2021, the Owyhee and Caldwell Health Coalitions, along with the University of Idaho Extension 4-H Leadership Club, worked together to create a vape prevention PSA. And then finally, one of our biggest projects has been the Senior Produce Program at the Caldwell's Farmers Market. So that program provides participants with a voucher for fresh local produce at the market each week throughout the market season. And let's go to the next slide, please. So continuing on with the Senior Produce Program, this year will mark the third year that we offer the program, and so we've started with funding from Blue Cross Foundation and St. Luke's. Over the last couple of years, that's shifted, so St. Luke's has continued to fund the program, and we've also received funding directly from the City of Caldwell to help support that. We're looking to expand that funding for this year. So for the first 2 years of the program, those vouchers were $6. We're hoping to increase that, recognizing that costs go up and our seniors are on a fixed income. The impact of that program, just really quickly, has not only been the opportunity for seniors to get that produce, but also in the relationships that they've been able to create. So many of our volunteers that operate the booth each week and are handing out the vouchers are local youth, and so it allows them to create those relationships with our seniors, but then also many of our participants in the program are repeat visitors, and so they are able to build relationships with some of the vendors at the market. So we did a focus group with the participants this year. That presentation, we gave a presentation to Caldwell City Council. So if you're interested, I can provide the link for that. But we're really great to see kind of the impact that had on the seniors and just the feedback that we got from them, and then helping to support some of those local vendors, farmers market. With that program, we were able to collaborate with some students from Boise State's graphic design program, and so they've helped to develop some materials that we will use this year at the farmers market. So that will include some signage that we'll use at the market, some brochures and other handouts that we will use, and then in trying to increase the sponsorships for the program with local businesses and residents, here for us to do that with our partner destination, Caldwell. Another recent success that we had is for most of the last 2 years, we've met virtually, and we decided that it was really important for us to have that in-person connection coming into this year. And so earlier this year, we had a meet and greet or luncheon with Mayor Wagner speaking to the coalition, and that was also an opportunity for us to have a check presentation from the city and from St. Luke's to help increase visibility of the program, but also to bring all of our partners together and recognize the work that was happening and the assets that we have within the. And then finally, we've been really fortunate to have some internships from the College of Idaho that are helping to support our initiatives with the Caldwell Health Coalition. So we have one of our interns that is finishing up this semester, and then we'll have another one that will start here in the summer, and we're really excited to have that partnership and that support from the College of Idaho. Slide, please. So here's some different pictures of some different programs that and projects that we've done, so you can kind of see the check presentation, the signage that we used for the Van Buren Walkability Project, and then the Caldwell Family Fun Day. We had some 4-H teen health advocates that came and helped to run that booth and did some fun interactive activities at the Family Fun Day, and we hope to have that happen again this year. So, slide please. That concludes my presentation. If you have any questions, I'd be happy to answer those.
Mr. Chairman, Daniel, I do have some questions. Which grant is it that this is supported through, and who brought it to us? Where does the grant come from?
The grant for...
Is there a grant for this program?
Commissioner Purdy, are you talking specifically about the coalition work?
Yes.
I would guess that there's multiple funding sources. As Brian said at the beginning, there's a partnership with the Extension Office, but from our district perspective, we don't have a grant specifically that funds this work. It's just our staff time.
Oh, okay.
Yeah. Mm-hmm.
Okay. And would you define equitable for me? Equity, I've heard that a lot. Might have a different meaning to me than it does to you, so maybe you would define that.
Sure, yeah. So equity, just for me, it means that we're ensuring that all people have access to those different points of care. So if we're trying to ensure that, for example, someone that has a disability, that we're providing them with the tools so that they are able to get the care that they need. So what that looks like for, someone that's in a wheelchair, for example, is not going to look the same as it's going to be for, a totally able-bodied person. So we're providing some of those, ensuring that they have those supports. And so that may mean that we're providing some additional assistance to that person in a wheelchair, but that's because that's what they need in order to be able to get the care that
First, I'd like to introduce myself. My name is Virginia Reyna Walling. I'm the Oral Health Program Coordinator, Dental Hygienist here at Southwest District Health. Okay. I've got a PowerPoint. It's just a brief one, and it's a pleasure to speak to you. I would like you to know that I'm very passionate about this program, and I want to say thank you for supporting this program. I think we do a wonderful job. Next slide, please. Okay, we do school fluoride varnish programs, and the eligible grades are preschool through 12th grade. And the schools enrolled in the program for 2021 to 2022 school year were 38 schools in our district. The total number of students that we have served is 2,537 kids to date. We've probably added a couple, 300 from last month. Total number of students served from July 22 to current of March 23 was 1,492 students. We do this in a 3-day period. And I am the only dental hygienist. I have an assistant that goes with us. So we cover a lot of ground. We serve a lot of children, and I think we do a wonderful job. So thank you. School-based dental sealant clinics, we also provide. We do 3 schools a year, and that is because we partner with Delta Dental, and Delta Dental does the majority of schools in our district. And there is the CDC provides funding for that program, and there's a stipulation that they have to be 50% and above free and reduced lunch. So we cannot do charter schools or private schools. And so we cover the schools that Delta doesn't do. So you can do grades 1st through 8th. The program begins the first of the school year and ends in May. And schools enrolled in the program for this year were 3 schools. And we added another school. We added Bruno. So we do Marcine, Snake River Elementary, New Plymouth, and Bruno. And the next slide will show you what a dental sealant is. It is a plastic coating that covers the occlusal, which is the top portion of the back molars. And what it does is it covers it so the deep grooves are sealed, so the kids, when they brush their teeth, nothing gets stuck down there as easily. We also do bicuspid. Any tooth with a deep surface we will cover and provide those. And then in the following year, we go back and we do retention checks to make sure that they're still on. And our cover letters will, when the parents sign up, they will receive a cover letter that they will sign that will give us permission to recheck those sealants and seal them and cover them if for some reason they have worn away. It's just a basic plastic coating. And with COVID, the COVID outbreak, we changed our sealant material to a material that doesn't need water, because usually you have to acid etch the surface of the top tooth, then you dry it. So we cut down on all the aerosols, and it's much more efficient. It's the material is slightly a little bit more costly, but it provides fluoride through the whole time that the sealant is on the tooth. So it's just, it's a wonderful product. Next slide, please. And then we also have our early childhood prevention program, and this is wonderful. We work with the WIC department, Head Starts, daycares, preschools, migrant seasonal Head Starts, and also in pre-K classes as well. And so we really target high-risk, low-income children up to the age of 5, these programs. Next slide, please. And so this will show you a photo of what is severe caries. And you can see that. We also see, I've worked for Southwest District Health for 16 years, and when I first started, we saw a lot more of these cases. We don't see them as often anymore, which is a real blessing. But the cost on there, I would say, is probably $1,000 to more like $10, because when there are cases like this, and that's probably like about a 5-year-old child, you have to put, it's usually a hospital case, so they have to be admitted to the hospital and under general anesthetic, and all the work is done. And so these cases we don't see as often, but we still continue to see them. They're usually children who are do not have any dental insurance or Medicaid. And this is one of the areas where we work with Delta Dental. They have an insurance funding for a one-time lifetime that they will, if the parents qualify because of the amount of income that they make, they will get $1,200, which will help at least with some of the caries that need to be taken care of. And we also have some participating pediatric dentists in our county that have really helped in previous years do pro bono work in real severe cases. So that's a blessing. Next slide. And we do educational outreach. So our district will provide perinatal oral health to pregnant women. We have done it in our WIC department after their breastfeeding classes, and we do them at the Baby Haven for Salvation Army. I do them in Spanish and English. We really try to emphasize the importance of perinatal oral health and their pregnancy and the outcome, and just overall perinatal oral health. If you can get the moms to have good oral health, their children usually do as well, and that's kind of related to overall oral health in general throughout a lifetime. So we provide it to Head Start, and we also go into health fairs for junior highs and high schools as well, things like that. Next slide, please. And we have our clinic. We are the only district that has an in-house clinic, and we try to provide services, dental cleanings, fluoride varnish, dental sealants, brief exams. We call them screenings because I am not able to do an exam, so it's an oral health screening, and we refer to dental offices. We would like to have our clinic run on a permanent basis. It's just, right now, it's really hard to schedule because our WIC program is usually the ones that refer over, so we're really working on that to get the clinic going. But I'm very proud to say we are the only district that has a full running dental clinic that's utilized. We have everything we need to provide the services we need to. Other than x-rays, we don't have an x-ray machine. Slide, please. And that was in our old clinic when we were downtown, and that was one of my patients, and all he was worried about he wasn't nervous about being in the chair, he just was worried about his hair. He didn't want me to ruin his hair for him, his mohawk, because his mom fixed it for him, so I had to work around the mohawk. And that is the oral health program. I would really like to say thank you for supporting our program. And we do serve all counties. We've reached out to Adams County, and that for the following school year. And that's probably the county that we lack in a little bit is Adams County. But we really try to reach out to all our counties and do what we can to help prevent tooth decay because it's preventable. Any questions?
Yeah, this summer's just I guess the question is that the amount of fluoride in water in this district is very variable. And in particular in Owyhee County, Jordan Valley, there's areas that have very high fluoride levels. And I guess my question is, and I think I know the answer, is that do the fluoride varnishes have any effect on that? So if somebody has high fluoride levels, is that going to change anything with their teeth?
We don't go to those counties that have the higher rates. We don't provide service to them because they have the higher rates of fluoride, yeah. And they probably, in their dental offices, do not receive it because they have such a high rate. But in correlation with that, you have to think people don't really drink a lot of tap water.
Well, I'm thinking of wells.
Well,
there's a lot of people who live out
we
in the
don't.
country.
Yeah, like Ola, we don't go to Ola. Any county with a high rate, we do not go to and provide services there, just so that we don't overdo the fluoride. Yeah, yeah.
The Bruno area also is known for its high fluoride. A lot of the kids there have brown teeth. Fluoride.
Yeah, we do. Those counties we do not go to. We've worked with our water people, environmental health, to get the updates on that because of and with all the new wells coming, it's very difficult to also kind of, all the new building and all the new wells is kind of difficult. We do ask them to, like with children, to talk to their pediatric dentist as well, or their pediatric doctor, so they know whether or not the children need to get fluoride supplements.
Other questions? Okay, thank you very much.
Thank you very much for your time.
Okay, now we're going to do the Western Idaho Community Crisis Center proposal response. Wait.
For the board members, there's no handouts in these next two topics.
Thank you, Dr. Zog. Good morning, Board of Health members. My name is Emily Strubar, and I am the Community Resiliency Program Manager within our Community Health team. And I'm here this morning to provide an update about the Western Idaho Community Crisis Center. So the current operating provider just wrapped up their 4th year of providing crisis services at the Adult Center. Due to this, we followed our internal guidelines for procurement process to go out for a bid, and every 4 years we follow this process. So we published that in early March, and the current operating provider chose not to reapply to operate the crisis center. We did, however, receive one application from an organization called Pathways of Idaho. They applied to operate both the adult and youth crisis center. I'll let Cass touch on the youth crisis center. So the proposal was shared with an internal team that's familiar with this project. We also shared it with the Western Idaho Community Crisis Center Advisory Committee for their input and feedback and ultimate support of their proposal. 2 weeks ago, we conducted a key staff interview with Pathways of Idaho, the scoring committee, and then also the WIDIC Advisory Committee. At the end of this interview, the Health Department made a recommendation to the WIDIC Advisory Committee to accept Pathways of Idaho proposal, in which they voted to do so. And so we have just wanted to bring this information forth to the Board of Health. We've had some initial conversations with Pathways of Idaho to begin the negotiation period, and then I have been working currently with the operating provider to develop a transition plan to be least disruptive to the Adult Crisis Center. And I'll pause there for questions.
Do you know why the previous provider had stepped away from that? Was there a problem?
I can't speak to their internal policies or what's going on internally to them. I will say that staffing has been a really cumbersome barrier for them. And I believe, yeah, I think that's the extent of it. Go ahead.
I feel like I can add a little bit more since I'm in regular communication with their CEO, and he's indicated to us that he is withdrawing most of their services out of Idaho to in Ontario, which I'm sure you're familiar with, is where they're kind of one of their biggest locations that they serve. So aside from the hospital that they have in Boise, they're closing their other services, from my understanding.
I just want everyone to sit on the WIDC board, advisory board, and Pathways is already doing work in Ada County, so a great fit over here. It'll be July 1. They'll be formally taking over on that date. We're in transition right now. Lifeways and Pathways are working together to a seamless transfer of companies possible. So it probably Pathways will be on some of the employees that are already at the building. So we're praying and hoping that this will be a great fit because it's for-year contract. So forward, I think they would have an idea of how to get the word out a little bit more than what we've had in the past. So I'm looking Pathways. Any other questions? We'll go on to the other one.
Thank you. And I just want to echo your sentiments. I'm looking forward to this partnership with Pathways of Idaho. They have a really great partnership with law enforcement, and they just provide really great behavioral health services in the region. Thank you.
Okay, now we're going on to the Western Idaho Youth Support Center proposal.
Good morning, Commissioners and Board of Health members. I am really excited to talk to you this morning. We have a few updates for you. So, as a reminder, I am Cass Adams, and I'm the project manager overseeing the Youth Crisis Center implementation. The Youth Crisis Center is now called the Western Idaho Youth Support Center. So if I say Western Idaho Youth Support Center or Youth Crisis Center, I'm using those terms interchangeably. So I am here to provide a very similar update to Emily. And so on behalf of Southwest District Health's Behavioral Health Project Team, which includes myself, Nikki, and other members of the Community Health Team, and the advisory committees that oversee Youth and Adult Crisis Center decision-making, Southwest District Health posted a request for proposal to accept applications for the delivery of youth crisis stabilization services for the youth in Region 3. And we also received one application from Pathways of Idaho, and the project team at Southwest District Health went through the scoring process, which includes reviewing their technical proposal, their cost proposal, and we also conducted a key staff interview with the advisory committee, as Emily alluded to. Southwest District Health recommended that we accept Pathways of Idaho's application, and the advisory committee voted to approve our recommendation to operate the Youth Crisis Center. Pathways of Idaho currently operates an Adult Crisis Center in Region 4 and is set to operate the Youth Crisis Center in Region 4 as well. They also have really extensive experience just providing behavioral health services in Idaho. And additionally, Pathways has really strong relationships with law enforcement and other first responders who will be really vital to the success of the crisis center. So that was really fast. Any questions or comments about that? I didn't want to belabor it since Emily kind of spoke to a lot of that.
Great, thank you very much, Cass. Very much appreciated. Okay, we will take a short break for everyone. A little ahead of schedule, that's it. We will break for about 10 minutes. Okay, everyone, I'm going to go ahead and come back. And this time, turn it over to Nikki, and this will be an action item, so I ask everyone to go forward with an action. So I turn it over to Nikki now.
All right, I'm going to jump in and discuss the request for change in employee compensation with the board. Last month, you may recall, we brought to the board a few different options we were considering as we were developing our budget. Each of those options included a 5% performance-based merit increase, but with some other drawbacks, I guess you could talk, or you could say, about implementation. So, consistent with what we presented last week is the 5% request for change in employee compensation. And this could be implemented immediately or on June 12th for an effective date of July 1st. The cost of the 5% increase if implemented immediately would cost $34,700 for this fiscal year. If implemented for July 1 for the next fiscal year, the cost to the district is approximately $300,840 for that 5% increase. And I'd like to talk a little bit about our justification for the request. We did have, as we have in the, I think we started this last year or the year before, having an independent evaluation of our pay schedule for employees by position, and that the results of that, which were done earlier this calendar year, showed that we're about 8 to 10% behind in compensation for the positions that we have in comparison to similar positions across our region. In addition, as I know you're all aware of, the cost of living in our area has continued to rise, and I put down some 3-year trends that we have there. And obviously our pay increases, while very generous of the board to support over the last couple of years, have helped. That, is a continued reality that the cost of living is a challenge for individuals. It's also a goal of the district to keep our turnover rate low. Coming out of COVID, as you know, we had almost 50%, actually I think just over 50% turnover in staff in just over a year and a half period. And we've finally really stabilized to that. I think we're just over 10% right now, which is great, and our goal would be to be below 10%. And part of the reason for that is, of course, we want to retain our top performing employees, but there's also a cost to having staff turnover and then also training new staff. Some positions are pretty easy to train. We can do that for a few $1,000s. Some of our other positions are very expensive to bring up to the training expectations of the organization. And then also I thought it might be helpful to just see what other counties, Central District Health and the state of Idaho have done in the last 6 months or so in terms of compensating staff. And the reason I select those is just because of the market. We're all in kind of the same workforce market, for example. And then I also wanted to just touch on the decisions that we made as a district to make this work in our budget. And what we did is we restricted quite a bit of our operating, so I'll touch more on this in our budget proposal, but we did some purchasing of items this year because we could afford to do that were anticipated for the next year. We are deferring some things, and a lot of those are around workforce development and training that isn't grant funded for this coming fiscal year. And we feel that a lot of this is driven by our decrease in fee revenue in our land development and subsurface sewage programs, and we feel like that's probably not a permanent trend, right? We're continuing to grow as a district and see that this is an economic downturn, but we know that those historically have all turned around, and we've had up times too. So we have drawn back there, and we also have limited our capital budget as well, keeping the things that are really important to get done. We have historically done a very good job of implementing prevention and keeping on par with our facility needs and prevention efforts. So we feel like we can reasonably restrict a little bit there this coming fiscal year. And then we also have some positions that, should they be vacated, we probably wouldn't replace this fiscal year. So those are some of the decisions that we have made to bring this proposal forward for the board to consider.
Mr. Chairman. Director Zog, here in the first bullet point, it mentions a third-party compensation evaluator in their report. Was that included since I've been here in a previous meeting that we've had in a packet, like that documentation?
Thank you for the question, Commissioner Brooks. I believe that Sarah, our HR manager, touched on it briefly last month, and I think she might be online, so she could maybe provide more information. We did have it presented last year to the board, and it felt like a lot more information than the board really needed. So this year I opted to just synthesize the information and bring that. Oh, you're right here. I was looking for you. Great. Come on in, Sarah. So I will pause and let Sarah probably say this more eloquently than me on how we handled that.
You're totally on spot on. There was no online, so I'd run down here. Yeah, we had the presenter present last year. Took a substantial amount of time, but I don't think that the response from the board was that was really a beneficial use of their time. So this year we chose to take that information, the same type of information for the same type of study that he did, and I just articulated those results last month with that data.
Mr. Chairman, could I keep going here? Okay, since I wasn't here last year, I would like to see that. Canyon County kind of writes a substantially larger check than the rest of the counties here. And so this is, I guess, an overall bigger picture kind of concern for me is that in my everyday job, like I see status change paper, we call them blue sheets. Somebody's hired, somebody's pay changes some way up or down, doesn't matter. By the time that sheet gets to me, it's got the signature of their director, it's got the signature of an HR rep, it's got the signature of our controller, and then it needs 2 county commissioners or it can be signed. I guess being the new guy walking in here, I'm being asked to support pay increases when I also sign payroll every 2 weeks. I've seen nothing from anybody, like what they make here, what they used to make. Like I have, a history of compensation. You, Director, just referred to that. I have no idea. I'm flying blind into a storm here. And I would kind of like some background info or some history of what's going on and where we came from and where we're trying to get to.
Thank you, Commissioner Brooks. It's a great question. Idaho Code outlines my role as the director of the district, and one of those roles is to set the rate of pay for employees.
Okay.
So that's the statutory direction and how I've functioned historically. And the board's role is typically, just for this purpose, is to consider annual compensation for the whole workforce in terms of an increase. Now, when we onboard staff, I determine that starting pay and approve it. Usually a proposal by a program manager, the hiring supervisor, routes that to me. And so I make those hiring decisions, equity pay increases like on a case-by-case basis, or if there's like a request that comes. I guess how we operate here at the district, and that's consistent across the other districts as well, as it's kind of described in Idaho Code. Does that help answer your question? And
Yeah, Mr. Chairman, Director, it does. Thank you for that. I'd still like to see the report that, you know, compares apples to apples, I guess, with the other districts, and I don't know whoever else they looked at to evaluate compensation-wise.
Sure. So they look at similar companies and employers in this Treasure Valley district that would be considered our competitors and their benefits packages as well. So I'd be happy to share that result.
Perfect. Yeah. Thank you. I appreciate that.
So I have a question, is that you can work this in for the next year by reducing some of the capital expenses. Do you feel like this is sustainable after that? How are we going to make those adjustments?
great question, Commissioner Beebe. Our hope would be we have a very clear plan on increasing revenues in our clinic area that we are already seeing positive trends in, so we feel pretty consistent there. And then we are planning on, the direction that our division has taken, the division in environmental and community health has taken on fees in our environmental programs, I would say is very conservative. I think if Colt or Troy want to chime in, but I think it's around a 3% increase in fees that they've projected, which will probably be under based on what we're continuing to see with growth and some development. Definitely a slowdown, but and please correct me if I'm wrong. Okay, I'm not wrong. So I feel like some of those changes will help, and because work has slowed in some of those programs, again, if we have some natural attrition, we won't refill those positions until the workload requires us to do so. So I feel like those are a couple of approaches that we're taking, and then our federal grants and sub-grants are things that we can work on negotiating and getting increases for, which we've had some successes already in some of those coming to the next fiscal year, and we'll continue to work on that as well.
Summers, how does this compare to what's going on in Central District Health?
Dr. Summers, actually maybe I'll have Sarah. I think you might have more updated information than me, since you want me to jump in. Okay.
Sure. So they have a similar approach, and they kind of look at outside competitors and things as well. DHR being a big one, since that's our main competitor. So they're proposing this year up to a 5% COLA, depending on the DHR pay schedule shift, as well as a 2% merit system.
Your increases are based on, they're performance-based, but so what percentage of your workforce do you think would not get this 5%, or on an improvement plan, or haven't met that standard?
Currently, we do not have anyone on a performance improvement plan. So as long as they've passed entrance probation, which would equate to 6 months of service with the district, they should be eligible for the 5% average.
It's basically everybody, right?
If they've passed entrance probation, yeah. If they've been hired within the last 6 months, then they would not be eligible this cycle.
Okay.
Yeah. Less than 10.
Chairman, Nikki, would you maybe speak to how you do your performance-based increase? I mean, what does that process look like, coming to get approved or not to get approved for a performance?
Sure. So it's based on an average, and so when we say 5% average, that's based on the scale of how the employees come in with their evaluation scores. We have 3 tiers: achieves, solids, and exemplary. So based on how many employees land in each one of those categories, we develop that 5% average from there.
Chairman Nicky, so you have correct me if I'm wrong, you have the final say though, based on the performance, or does that stay in the department, or how does that work for if someone would get this or not?
Typically, how we've done the merit-based increases, if the board approved it, then we implement it based on just what our change in employee compensation plan says that the board also now approves, and which is pretty much these criteria that we identified in the top paragraph. And so I don't really interfere with that. I feel like that might open up a liability if I implemented it differently. Yeah.
Any other questions?
Mr. Chairman, considering it is an action item and the concerns that I've expressed, I would not be in favor in making this happen in the middle of the fiscal year.
But
So, go
sorry.
ahead.
I think what Zach's saying is there's one of the part of the proposal is to implement it immediately, and that's what I think. Is that what you're speaking to?
It is.
That part of it,
Yes.
I think he's saying he doesn't feel comfortable with pushing it back maybe to that July 1 date is probably a better option for us.
You are correct. Yes.
Do you wish to wait until July?
I wish to wait. Prior boards in Canyon County have opened the overall budget mid-year, and it may or may not create some challenges going forward, and I would like to get out of that process, or that that way of operating, I guess I should say. So I would prefer to wait.
Okay.
Especially until I get that report and a little more historical knowledge of what's been going on.
Okay.
Thank you.
Will you up on this until July 1 forward?
For any type of, I think what Zach's saying is for him personally, he just doesn't feel like he's. Yeah, but I don't know. I don't know if this can be tabled though. I mean, Nikki has to put a budget together, so I think there has to be a decision made today. I'm thinking, right, because of the fact that she has to go to counties and present a budget.
All right.
Wrong?
That is correct, unless the board wants to have another meeting on the schedule, make these decisions before, so that I can do those budget presentations to each of the counties.
Chairman, I would support Zach. I would have said anyway up first. So as far as that goes, our fiscal year starts July 1, correct?
That's correct.
So that's when we would make the change in with me, but what we're looking at here for raises, want a decision on?
Yes, Commissioner Purdy, I'm requesting a 5% increase for consideration of the board.
I would support a 3% increase. Go ahead.
Mr. Chairman, this is kind of a weird process, I guess. This is extremely weird to me compared to the way we do this at the county. So, it seems kind of an unnecessary. This doesn't need to be adversarial, I guess. It's kind of what it feels like because I'm questioning it, and you have employees in the room, and people are going to be listening to this, and it concerns their wages. And I'm not even saying I'm against it. This is more of a matter of procedure, where we don't get the same, I guess, real time information as this board concerning this entity. Whereas this entity were at Canyon County, it would be a top 5 budget item, as a director. So it's kind of a weird deal. and then to where we've got to approve something so you can make a budget and then go back to the counties where counties may or may not even approve it at that point. And I'm not exactly sure how to even work around that. I guess I'm just bloviating here out loud.
I think as a new member of this board, Zach, it is very different than the way we do things at the county level. So it is. You're right. Every one of us that was new, our head was spinning the first time we sat there during this process too. So you're not alone. That's how all of us were, because it is different, and there's a lot of contingencies, right? We have to get a budget that Nikki can present to the counties, and then our budget hearing, the chairman of which I'm not sure who your chairman is, Zach, now, but the chairman will be the one who gets to make that decision, probably you by proxy, but it is a very different process. So you're not alone, and the first time sitting there, it is a head spinning part of this. So you're not alone.
And it has changed in the last couple of years. We went from paying about 16-17% budget to about 35% of the budget. So it has changed, but there was gives and takes on that, and depending on what money you're from, actually a savings to the county to go. Smaller counties didn't get as great as the larger counties did. It was a break for the counties to go into this route. So yes, things have changed somewhat. Other issues are we have earth and here on the state fiscal year, we're on county fiscal year, so they're 3 months ahead of us, 4 months ahead of us. So that's why we'll be doing our budget. We start doing our budgets now. She's got to have a budget ready. So all of us in a greatest position in the world to be in, but I had just made wow. How does this work? Money into the program. For us, when not all, but most counties.
I mean, yeah, and House Bill 316 revolutionized this process for us as the board too. Some of this was kind of out of our hands when they were under the state, and now that it's county funded, the indigent, health money that was set aside there went to the health district. It's certainly transformed this process in not in a more convenient or easier way for us as the board, I would say. And I experienced both shortly. I was prior to 316 and then post. So yeah, this is a confusing process for sure.
Mr. Chairman, if you'll entertain this for a moment, I guess, for the new guy. So say we go with this 5%, right? So you can go present it. Go to a county or 2 counties or whatever, and they say no. I don't know if that's ever happened or whatnot, but I mean, I'm representing a board, but I don't control how they vote when you come and present it. What is the process then? I mean, do we have negotiating right there, or you've got to go back, redo it, and then re-present to the rest of the counties, even if they accepted or did not accept?
Great questions, Commissioner Brooks. So the process today will be hopefully approval of the compensation request, and then we'll talk about next what percent the counties will support. So this isn't 5% burden on the counties. This is 5% change in employee compensation. The request to the counties is a 3% increase 3% increase request from the counties, but for each county, that's gonna look different because it has to go through the formula. So some counties will pay more than 3%, others less than the 3%, if that's what the board chooses to support. So that will be then, built into the budget that I'm proposing next on the agenda. And that's what I will, if the board supports the budget as presented today, then I will take that proposal to each of the counties. And the counties, at least in all of the presentations that I've ever done to the counties, they've never voted on it in my presence. So if they do that, it happens somewhere else. And then what happens after my presentation is the budget hearing that will coincide with the Board of Health meeting in May. And there, a majority of the vote in the budget hearing will determine if the budget is supported or not. And so we'd like to go in knowing that, you know, we're going to have a good chance of passing this budget, because by the time the end of May comes around, if we had to go back and adjust and go through the whole process again, it would be really hard to meet the statutory deadline. So, but again, we need a majority vote. So if Canyon County didn't support the proposed budget, that would not, I don't want to say it wouldn't matter, it might hurt my feelings, but at the end of the day, if the majority still supported it, it would still get implemented, if that makes sense. So,
did do that one time when our director, Canyon, vote, the rest of the board voted, I vote.
not uncommon for a county to vote.
Understandable, where questions that were brought up, but when you look at services, the percentage, higher percentage of people in Canyon County service, then that's how the rest of us boards look. Our counties were not for percentage. The rest of us look at it. Always ways of looking at it. Getting more of the services less than what Canyon County. So that's how we looked at it.
To go back a little bit to the employee compensation, can you just give us a little bit of background on what it's been in the last couple of years, maybe?
Sure. Sarah, do you have, not off the top of your head? Okay. So I think maybe Troy, you want to back me up here, Troy? I'm going to guess. But I think we had a 0% increase in 2020. But then the board approved, I think, 2 different pay increases in that might have been fiscal year 21, and then 22. They improved 2, and then last year, not sure. I know it was CEC, but I don't remember what percent it was. 2 and a 3%. Was it split over fiscal year? Oh, COLA. Yeah, thank you. COLA and CC. Thank you. And we did a bonus.
Right.
Okay.
We had 2% COLA last year and a 3% performance to equal 5.
Yeah.
Yeah.
And then Sarah also mentioned we did the board supported a bonus too.
Yeah.
A one-time bonus.
Yeah, a one-time retention bonus of $2,000. Had 6 months of service. By cutoff date was determined June 12th, so by December 12th.
I think part of the, I know the conversation we have at our county all the time too is, if we want to retain our employees, just because the cost of training our, I asked the sheriff one day, like, how much money goes into a new employee, and the sheriff's office is probably the highest. It was in Washington County, it was $100,000 easily to train a deputy. So to retain that deputy was fiscally much more responsible than to lose that deputy and then to have to retrain. I'm sure there's positions here, like you said, Nikki, that some of those are maybe a couple $1,000s transition, but other ones are probably significant. So that's always a part too, as we look at that, is nothing and your employees feel like they're not supported at all, and they go find somewhere else to work. Does that actually save us money, or does that cost us money? At the end of the day, it actually costs us money.
Well, recruitment across the board has been such an issue too. So, in order to recruit people, you have to be able to pay them properly. So, I understand that.
Around the bush enough. That's time. How the board wants to move forward with compensation. Of motion, she did. Yeah, 3%. General. Okay. All right. So if I would.
Sorry, this is on the motion, guys. I apologize. Nikki, would something like we did last year work again, where we split it? Because I felt last year like that gave us a little. Everyone got something, right? I mean, everyone got at least a 2%, and then the 3% was based on performance. Would that be something that you think would be fair again?
Yeah, I do.
I felt like we had this conversation last year, and that's where we landed on, right? Was we felt like that's.
Yeah, I would maybe ask Sarah if she feels like there's any unintended consequences of that potentially, but I don't think of any.
No, I don't think there is. The spread will be smaller for the merit increase than it is currently, just because we have a less percentage to work with.
Can you explain what you did last year?
Chairman, we did a 2% COLA and a 3% performance base. So everyone got 2%, and then the 3% was based on their performance, is what we did last year. So it equals 5 at the end of the day, possibly, right, for an employee, or not.
So again, in this particular case, according to this performance system, pretty much everybody would get the performance increase. So would the same be true with this other system that you're talking about, or no?
The 2% would apply to everyone, even if they were on entrance. And the 3% would apply to anyone who has tenure over.
Yeah, so what we did last year may actually fiscally cost us a little more than this proposal, because everyone gets that 2%.
So just from my understanding, so people that have been here less than 6 months, when they first come on board, does everybody throughout the year, regardless of when they're hired, start at the same pay? So if somebody that just got hired a month ago, are they getting paid the same as somebody that got hired 9 months ago for that job? So I'm trying to get at, do they need a cost of living, or are they already started at a higher rate?
I think, excuse me, I think that's a great question. So when we come up into this season, we know that we're anticipating these kinds of movements. So I generally work individually with every single hiring manager that comes in with a vacancy that they're looking to fill. When they have a candidate, we look at their experience just like normal. Throughout the year, we start them off based on experience, so not necessarily at the bottom. If they're entrance level, or if they have maybe like less than a year, then it's usually at the minimum that we have, the 85% now. But as we move closer to this season, we take those kinds of things into account, that they would not be eligible for these increases. And so we kind of work collaboratively with them at that point, knowing that they would miss this cycle. They are somewhat included along the way. Probably
about a month or so ago, I've started kind of transitioning that mindset with those that come up, knowing that this is part of that. We had 6-month cutoff would have been like December 12th this year. We had not had any hires from October to December, so there's nobody that really be missing out. It's really these from the last month or so that we've been catch along the way, knowing that they won't be.
So they're not eligible for an increase after they reach 6 months. So it'll be a year and a little bit before they're eligible for anything.
They would be eligible for any COLA and any bonus, depending on the criteria for that, but no merit-based increase.
So, our most valuable asset is our employees. And keeping those employees is, I think, critical. Where did the number, the Adams County there is going up 6%, Canyon's going up a minimum of 9%, Gem County 7%. Where did those numbers come from? We're arguing about 5%, and it's less than what you're already offering your employees at the county. Oh, that was last year?
Yeah.
Okay.
So we have,
But what are you going to do next year?
we don't know yet. We haven't, in
But
Washington
you're going to
County,
be addressing it, aren't
Washington
you?
County, we haven't
I mean,
had
that's
that.
a big deal.
Yes, it is.
And I worry that, and I guess I'll preface it and say, I don't have a dog in the fight here. But I do know your most valuable asset is your employees. Ada County is 20 miles away. If we're not somewhat commensurate to what they're doing, we're going to lose a lot of employees. All I got to say.
Mr. Chairman. Dr. Summers, I don't think anybody's arguing that against your point. I think we all agree with that. Many of us, I'm sure, run our own business. We're very well aware of costs of training and rehiring and trying to find people, recruitment and that whatnot. So I totally agree with you. And for the sake of moving this along, I'm going to make the motion that we go with this so you can go build your budget, but I'm also going to have the caveat of saying, I guess I'm going to cop out like the legislature does and give myself the ability to vote for something in committee and then not necessarily support it when it gets to the floor. You know, just this is such a screwed up process, in my opinion, of, you know, I'm basically moving something along to give my fellow commissioners the opportunity to view it, and so you can move forward and do your job, and then have no idea what sort of buzzsaw you may or may not walk into by the time you get there. And I have all these other questions where I have no history and, you know, until Commissioner Haynes just brought it up of what was done last year and that kind of thing. So I would, I guess the motion is I would move to adopt the proposed 5% that would start at the beginning of the fiscal year.
Commissioner Haynes, second.
Moved and seconded. Is there any more discussion? Okay, all those in favor?
Aye.
Aye.
Aye. Those opposed?
Nay.
Guys have it. On record that Vicki voted no. On to the fiscal year 2024 county contributions. Thank you, Sarah.
I'm going to move us along. Thank you, Commissioner Brooks, for that motion. I also noted that I'll include the history of the compensations, I think, for the previous few years. I think that's good to help you guys in the future. And we'll get that compensation report out to the board as well. Yeah.
Can I ask that, because of the timing on all these things, that maybe, if possible, District Health would bring this out at least 1 month earlier, so we have time to go and visit with and look at numbers and to visit with our other commissioners so we have a better idea of what we're doing here as a board. And I think that would help with the other board members also, if we could do this a little bit earlier, being that we're on a different fiscal year than the counties are.
It's a great question, Commissioner Absteri, and I think we tried to do that this year, and it's hard because we're still trying to get all of the information for our budget too. So that's why last board meeting I felt like we weren't really that helpful to you because we didn't have really defined information to provide you either. So and I definitely understand your positions with the fiscal year not lining up and how it's hard for you to support something not knowing what you're going to be able to do for your counties either. So yes, I want to honor that request, and we will try, and it's just, it's hard.
Mr. Chairman, I'd like to piggyback on that. As far as the packets, I was going to kind of save this for later, but I guess since you brought it up, getting stuff earlier, is there any way to get the packet before Friday, prior to the meeting?
Yeah, I will continue to work on that. Our goal is to try and get it Wednesday before then, and yes, but thank you. Would Wednesday be okay? That's kind of the goal we set for ourselves, and
that would be much
Friday.
Preferred.
Thank you.
Yeah, Commissioner, I'd back you up on that. Commissioner Elliott brought that up last year, and it still hasn't. I think we got a couple a little bit earlier, maybe like on Thursday, but we never have gotten them enough time to really review them well. So, got anything else going on or other meetings and stuff on the weekend and kids, and it's impossible to go through all that. Especially last month where we have like 90-some pages to go through. Yeah, it was.
Yeah, I understand. Thank you for that feedback. Okay, I'm going to jump into the request for county contributions. And I will give just a little bit of history here before I jump in. The history of the county contributions is, well, I wouldn't say the history, but it's defined in Idaho Code 39424 on how the county's contributions are determined, and that funding amount is based on the prior year's funding that the counties contributed. And typically what we will propose is somewhere between a 0 and 3% increase from the counties. And the way that is then implemented is each county is run through this formula, looking at changes in their population and changes in their property valuation. So 70% is based on change in population and 30% is based on property valuation. And that will kind of spit out what each county, as I mentioned earlier, will, the financial impact to the county. And I'm asking for consideration of a 3% increase from counties this year. And the first page is that 3% with the data that Troy has provided or compiled. And the top table is based on the county's fiscal year. So again, this is going to get a little bit hard to explain. Feel free to ask questions. And it's really just because of the fiscal year misalignment. But we have the changes in population from 2021, although I think that's supposed to say 2022 now that I'm looking at it. But the population estimate, and then the percent, and then the the percent of property valuations, and then the last column. So the one that you really want to probably look at is the one that says county, and that's the kind of blue at the top, I think. It says total FY24 county contribution, broken out, and then to the far right is what the contribution was last fiscal year. So that's the top table. The bottom table is how this is implemented on the district's fiscal year, if you're interested in the more complicated table. So that has broken out by county, again, what the financial payment would be. So when our budget, new budget year starts on July 1st, you'll continue at the same rate that was approved last fiscal year, your last fiscal year through September, and then when your new fiscal year starts, this new, what's approved in this budget year will go into implementation for you. So you have like kind of this lag time in your budgets from the past fiscal year to the current fiscal year. The important column in this bottom table is probably that dollar change monthly and the percent change that articulates really where county kind of comes out in the formula. So in this coming fiscal year, Canyon and Gem County saw the greatest changes in population and property valuation, which really drives them up over the 3%. And then to the opposite side of that, you have Canyon or Washington County, which I think did grow and increased in property valuation, just not at the same rate that the other counties did. So their percentage actually goes down. So that's the 3%, and this is just a repeat of this, basically the same tables, but with different amounts on the next few charts. So I won't review all of those. But again, we're asking for consideration of a 3%, 2%, or 1%. The overall change to the district in terms of funding, I believe, is just over just under $89,000 from last fiscal year to this coming fiscal year in terms of funding to the health district. Roy, is there anything that I missed or that you want to add or explain?
No, I think that was great. I think I just want to be able to entertain any questions. I think to the point that the comparison of our two fiscal years can be a little bumpy, so especially for folks. And this is a little new for us. In the past, when I first started, it's been almost 3 years. Yeah. We actually didn't do the fiscal year conversion because the difference between the first fiscal and ours was just enough that it really provided no benefit. But since House Bill 316 has happened, there was just such a significant jump in those first couple of years in what the counties were contributing that created a pretty wide disparity between and ours, and it kind of created a difference in that equation as to what actually lands in our fiscal year. So I created this kind of conversion from your fiscal year to ours to kind of help kind of temper that and to create an environment where you can kind of see those changes. This fiscal year should be the last year. I know you guys in the counties have stopped seeing those impacts on House Bill 316, a jump from one year to the next, greater than what we're requesting. Our budget still, because we're on the state fiscal cycle, still has a little bit of that lag from House Bill 316 because of carryovers into our fiscal year from your prior fiscal year. And it's really bumpy, and I'm happy to help. But that was really why I created that conversion table, so you could kind of as it landed from your.
And I would just maybe add, I don't know that we said this up front, but that the county's obligations to the health district changed incrementally. So it wasn't like a one and done. So that's what kind of drove that, those changes over multiple fiscal years.
Mr. Chairman, Director. So am I reading this correctly? 3% increase on the county contribution portion of it is a roughly $90,000 increase for the current fiscal year?
In total, correct. I think it's just
from the county?
From all
six, the counties?
All 6 counties combined.
Okay,
correct.
so the majority, let's see, personnel is increased. I'm reading this. It's on page 4 of your.
On my budget proposal.
Yes. This personnel increase is 15% or $828,000. So 740-ish of that is being picked up. How?
Very good questions. Those are going to be picked up either through sub-grants or through fee revenues. Missing anything? That's pretty much it.
Yeah, and Commissioner, it also kind of, based on what August talked about, is there's an environment where this year particularly, because of some of those decreases that we're anticipating for an economic downturn, made some cuts in operating. So some of those operating cuts, essentially what we're doing is you wind up shifting money that was in prior years operating, you wind up shifting it in. And this is the only opportunity we have to do that. That's not a normal move for us. We do that unless it's forward. So some of those savings that we created in operating, and I think the programs did a really amazing job of kind of slimming down, but I think to Commissioner's question, is that sustainable? And there is an environment where in this market, if things stayed static, again, next year, if we continued in a long-term downturn, then we'd be having this conversation again. We'll be having conversations of what cuts can we make. But I think to Nikki's point earlier is that economic models, from what I've seen, is that a downturn is not considered at this point. From what I've seen, and again, I don't have a crystal ball and I'm not an economist, but from what I've seen, economic downturn is not at this point predicted to be longer than what we are anticipating. So our hope is that as revenues can increase with the work that the clinic is doing and some of the revenue fee changes we're working on in age, that those revenues will help offset to make it long-term. Think of some of those cuts that we made in operating help to support this 5% increase.
Yeah.
Yes, absolutely.
If necessary, I assume, but that everybody's had a chance to digest a little bit of this. Favor.
Commissioner Abbotsford, I wonder, sometimes I feel like it's hard to know what to put in order in these agenda items because they're all fairly interconnected. I could go through the budget proposal if that would help the board make a decision on the county contributions if they'd want to come back to that.
How they would like to move forward.
Mr. Chairman, I'd be open to that. I think it's a good idea.
Seems to be the board's request. We move forward with the proposal.
Thank you, Commissioner Abbotsford. All right, we're on budget proposal page. It says budget request at the beginning. And for the newer board members, this is a draft of what I'll present. So if you have, aside from the decision making, if you have feedback on how I could, better articulate this to the Board of County Commissioners when I meet with them, that feedback would be helpful too. We go through this. So I did try to make this very clear that we happen to fall in the state fiscal year. I usually try to start out with a little bit of a summary of the last fiscal year or current fiscal year and how we're planning for the next fiscal year. For us, most notable are, in terms of budgetary impacts, was the downturn in anticipated economic downturn, which then resulted in some fee revenues dropping, which we anticipated to happen, but not quite as much as we, more loss there than we anticipated, although I would say I think since maybe October or November, those revenues have stayed very consistent. We're not seeing a trend downward anymore. So it has been helpful to see those trends month over the last few months, seeing them level off. And we know that spring is usually, things get busier, so we're anticipating that as well, which is encouraging for us. And then the other big budget impact is the funding that we've received to support Youth Crisis Center services and really strengthen our youth behavioral health system across our region. And that I think we secured just over $3 million last year. And a lot of that, as was mentioned earlier in the meeting, will not be spent out this fiscal year. So that will be carried over in restricted funding moving forward, so that we have drawn that out of our main budget, and so you can see that later. In terms of impact to the counties, as Troy mentioned, the state fiscal year, or House Bill 316 has been fully implemented, and while that doesn't really have an impact on our budgets, the financial obligation definitely, we recognize is changes for the counties, and that has, kind of going back to some of the history of that the counties generally felt that they would have a financial benefit from the change with taking on the counties versus, or not the counties, the health districts, rather than continuing to cover indigent medical services. And how that looked for us last fiscal year is that the county supported about 24% of our overall budget, and this coming fiscal year, that will be 27% of our budget. And that's probably pretty consistent with where we would expect it to be. Prior to House Bill 316, I'd say 15 to 17% usually was supported by counties and then the state, very even in our health district. And then I just would like to go through and highlight some revenue, our revenues for the next fiscal year. We do anticipate receiving some state appropriations, and those are Millennium Funds that the Millennium Fund Committee has awarded the districts, and then also our opioid settlement funding comes through appropriations. Moving on to county contributions, again, we're requesting a 3% increase. This equates to $88,954 change in the positive from counties to the public health districts to support the work of the districts. Our fee revenues, I mentioned earlier, are very conservative. We're estimating those to be at 3% this coming fiscal year. As I mentioned also earlier, I feel like I need to stop saying that. The clinic is in the process of rebuilding. They have, we're starting to see a lot more clients there and continuing to build, and have actually built in some funding in this coming budget year to add providers, both nurse practitioner on the medical side, but also added some behavioral health capacity, which will be new for our district. In terms of other revenues that we anticipate receiving, the state was awarded some public health infrastructure funding from the CDC last calendar year. It was restricted for use by the Idaho legislature and can't be used until July 1, and that is a 5-year funding award. However, we have to get legislative approval to spend it each year. So we're on a year-to-year basis on that. This will be the first year we'll be receiving that. We are also receiving some funding to address drug overdose prevention, tobacco education, and those are that we're anticipating receiving, and those are coming through either federal sub-grants, direct grants, the opioid settlement, or Millennium Fund. So increases in those as well. Sure.
With your fees, I know you presented some information a couple months ago about looking at the fee structure for the clinic and whatnot. So, but is that something you review every year in terms of how close the fees come to covering the costs? Yes.
So most of our fees are set to cover cost, particularly in our environmental programs, except those that are statutorily set, which don't cover hardly half the cost. But and then on the clinic side, I would say those fees are set at cost, but we also take into consideration reimbursement rates, and we also have a sliding fee scale. So it's a little bit more complex in how we set those fees, but we do bring those to the board annually for review. Some of those fees we do have board approval to fluctuate the fee based on the cost of the product or medication or device in the medical clinic. That helps.
Yeah, we just voted on that. So 42 for the fees. I wanted to make sure that was.
Thank you. All right, I'm going to proceed and move on to page 2 here and go over the expense highlights. And so we're talking here about the cost of living continues to outpace wages in our region. We did have an independent evaluation of the wages and have addressed some of those by addressing compression among existing positions, adjusted the pay schedule upward, and raised the lowest paid positions to $16.75 an hour. We are also requesting a 5% merit-based increase to help retain the talent here at the district and mitigate the impacts of high turnover.
Mr. Chairman. Director Zog, please forgive me. I should have included these comments with our compensation discussion earlier. I have an issue, and this relates back to my comment about what the county did last year. Flat percentage increase across the board. It would be my desire to see, and you can do whatever you want, I guess, if it's approved, but a flat percentage increase across the board obviously helps those at the top a whole lot more than it does those bottom. So I don't know where your employee turnover is happening the most, but maybe if you looked at it from a standpoint of that 828,000, shoving that more towards down the line away from the top, if your top is not cycling out as much as your lower paid positions, however you want to say that, but that was something that was done at the county last year that it definitely eliminated any sort of wage compaction because at the top, but it made the gap so large, and people at the top got extremely large increases. And when you look at it year over year, or even combining it with some mid-year increases, this 14% number in here you have is really small compared to what some other folks got. So I guess, again, forgive me, I should have included this in our previous discussion, but it's a lot easier to support these kind of wage increases. And you asked for ideas or comments, how you want to get this past a different board or the rest of the county. So I'll speak for mine, is if you present it in a way that the people that the positions that you're experiencing the most turnover and not at the top are getting more of those increased wages, that's going to be a lot more palatable.
Chairman, I'm sorry, can I kind of piggyback on Commissioner Brooks' comments? In Washington County, we brought the floor up to 17 a couple of years back because that's where we were experiencing most of our turnover. I think we were starting people at 1425 or something. So we took a pretty large jump, but it was because of the fact that that's where our turnover was, right, was in those positions. So I think Commissioner Brooks' comments are appropriate and wise, I think, in that, you know, maybe you already do, but I think if that's where the turnover is, then that's where we target
Right.
more.
That's great points, and we haven't talked about it too much as a leadership team, but I know this, like, for example, the state of Idaho did a $1.20 increase for all positions, and I think that was an intent, was probably toward what you're saying, Commissioner Brooks, because that $1.20 means a lot more to somebody making $16 an hour than somebody making $50 an hour, right? So, and we have not, we do address compression, and we look at positions, that salary assessment that we have done is by position in the organization. So, but I also know we have a position that we're trying to recruit right now that's at that $16.57 an hour. We're going out for, I think, the fifth time for recruitment, and that costs about $5,000 every time we go out for recruitment. So it's just something that we could definitely consider.
Chairman, I had an eye appointment in Emmett last week, and the McDonald's in Emmett is advertising $15 an hour starting wage with paid time off at McDonald's. And not that they don't have responsibility, but I'm assuming whoever starts in whatever position we're looking for maybe has slightly more responsibility than somebody starting at McDonald's. So I do think Commissioner Brooks' comments are good. I think if we're looking at that pay scale and increase and where his turnover is, that bottom end is often, we saw in our county at least, where we saw the turnover the most.
I appreciate those comments, and Commissioner Brooks, thank you for those as well. And yes,
Mr. Chairman, Director Zog, I would also include, I guess use it against me, but my own observation of the substantial increase in employee compensation is being picked up somewhere else, not in the county contribution.
Yeah, that's probably an accurate statement in terms of where the funding sources are coming from. There's multiple funding sources, and when I get to the personnel section, well, I'll give a teaser. For the personnel section, obviously the 5% in merit, it does not equate to like the 15% or so increase in personnel, and a lot of that has to do with some of the addressing the compression issues, raising the floor, but also some of the positions that we're hiring for are like the behavioral health providers or the nurse practitioners are just more expensive positions to fill. So it's kind of a compilation of things that have driven up the increase in personnel costs, and it's not just the that change in employee compensation that we are discussing. I don't know if that addresses your comment, but I'll move on to employee benefits. Our employee benefits this year have risen by 8%, and for those of you that are fairly new to the board, we have agreements in place with the State Office of Group Insurance and also for their health insurance benefits. So pretty much all of the benefits that state employees have, we receive as well, and don't really have a lot of say in we don't get to negotiate those, I guess is what I'm saying. We're a small fry in that system. In terms of operating expenses, our operating expenses here are going to change very drastically, and I'm sure that will raise a lot of questions too. So if you have thoughts about how I could better articulate this, that would be great. But the primary reasons for these reductions for this big number, I believe, and maybe Troy can confirm or refute, is last year we had quite a few funds coming in from COVID that were budgeted into operating that we do not have going forward in the next fiscal year. So that is the big piece of this, and I can probably get a little bit more detail on how big that portion of that number is, Troy, I think that might be helpful for the boards of county commissioners to know. And then, like I said, we also did just some restricting on just our general operating as well moving forward to the next week. Yeah, it's a big number, and again, I think a lot of it had to do with some of the COVID funding that we had budgeted last fiscal year.
Has that million been spent? Carrying over.
Chairman, that's a great question. So currently, the grants that we still have active for COVID are the ELC grants, and that grant is still got a chunk of money that we're still working on through the COVID. I think it expires 30th of 24. So they are in the process of expending it. I wish I had a clearer answer, but they are in the process of getting those expended. I know that program managers are working to find out what the scope of those are and what we can use those for. So I do know that their program is working to get those expended. To answer your question.
I'll move on to the capital expenses. We also anticipate a decrease of $146,000, well, just over that amount, in the next fiscal year. And part of this is probably more of a move towards normal than really a decrease. And the reason I say that is for some of you who've been around a little longer during COVID, a lot of the contracted projects that we had scheduled got delayed due to workforce issues or supply chain issues. So we were carrying over some projects over multiple fiscal years, and those are finally getting done. So going into the next fiscal year, we see a decrease, but again, it's not hugely substantial, and we do feel we can be very responsible with completing capital projects that need to be done and delaying some of the improvements that we're trying to, for example, in our space here, build some additional capacity for employees. And we have a huge facility, but the way it's designed is there's opportunities for additional office space that haven't really been developed, I guess, for a way to say that. So that is a project that's on the back burner for maybe next fiscal year that we have in mind. So, but all of the necessary things will be accomplished. Moving on to trustee and benefits, and again, these are funds that we budget that will be passed through to a sub-grantor to complete. We are decreasing these by $168,640 from the last fiscal year, and those are really that's all driven by sub-grant work and obligations. So we just have less going in there or planned for this coming fiscal year. And I think that might tie back to some of the grants that we know are going to be terminating this fiscal year. And then I have just a summary here of noting the continued growth, population growth in our district, and how we have continued to really work to be fiscally responsible and work lean and mean, I guess. Is that a statement in a positive way? With our pretty steady FTE count since 2017, we've really been right around 100, 105, if you kind of take out those COVID positions that were temporary in the district. And again, we really appreciate the partnership that we have with the counties, not just the financial support, but we work with the counties in a lot of different ways outside of just the financial obligations, and those are really meaningful relationships for us to have and appreciate them very much. Moving on to page 3 is really the nuts and bolts of the budget request, and I will really focus on that last column on the right that's yellow, but for your reference, there is some historic data on the left. I mentioned earlier that we have a very modest increase in our fee revenues, and that is noted here as well from our budget revision, and even looking at the prior fiscal years, we had anticipated some declines and are kind of digging out of that. And a lot of that, I think, had to do with some changes probably in our clinic side, and then also just the environmental side going up, and then finally kind of leveling out. In our contracts area, we will see a slight decrease there and some shifting of work. So again, some of that is funding that we know will already be going away this fiscal year. And then our county funds, this has the built-in 3% change, so if that will stay or change potentially depending on how the board, what direction the board provides. This budget has no state appropriated funds in it in terms of general fund state appropriated monies. The Millennium Fund appropriation here looks significantly less, but a lot of that will actually be passed through as sub-grant funds, and so that really shows up in contracts. There's a little bit here that is a direct appropriation. Our interest estimates, Troy said, seem very conservative based on what's happening currently, but as you know, we don't know what will happen in the rest of the fiscal year, so we have $150,000 budgeted there. The changes in our revenues for the sale of land and buildings and equipment is less. The big driver for that is that most of our vehicle fleet we have been moving from purchasing to leasing, and so we're not selling off vehicles as much every year. So that's why there's a little less revenue in that spot. The other category, sorry, give me a little note here. We have some carryover grant funds that are from, like nonprofit grant funds, basically, that will, well, that's a carryover probably. No, it's not. That's client. Yes, I don't know why some come in carryover and some, I guess they're not carryover. They're just anticipated grant funds in other. Thank you, Dre. And then we have the carryover funds, which includes funding from the Citizen Review Panel. Is probably state appropriated originally funding, and then also some nonprofit funding from United Way that's carryover from this past fiscal year, and then some behavioral health board remaining funds that have also been carried over. So that's the revenue summary. I'll move on to the expenditures. Again, this is our expenditures on salary and wages goes up quite substantially in this budget. And there is more detail here on the right page on that, and I've touched on it already, but I'm happy to address any more questions that you have. The employee benefits also, as mentioned earlier, that 8% increase puts us over $2.8 million. Our operating budget goes down to $1.7 million. That, although if you look at fiscal years 21 and 22, it's pretty, not too far off those prior fiscal years. So we really had that substantial bump last year with some COVID funds being in there. And then, like I said, we've done some restricting of our operating budget this fiscal year anyway. Capital outlay, again, decreased, not too far off from our 2021 budget, but again, trying to get some of those projects done over multiple fiscal years due to delays in contractors being able to accomplish the work. And then, so really overall, you'll see here our district budget for just day-to-day operations outside of crisis centers is actually going down a little bit from the prior fiscal year. And then moving into crisis center, the crisis center renovations, I won't go into a lot of detail here, but we do have the crisis center funds, and we typically pull those out because the direction of the board in the past, and I agree, is that we want to keep those separate and not be subsidizing those funds with county dollars that are really intended to support the district and not just that one service line. So we monitor those funds separately, and as you'll see, there's a influx of new funding, and that really goes back to the funding that the district has received to stand up youth crisis center, or I should just say youth behavioral health, because it's not just crisis center, support in our area, and a large majority of that, almost all of it, is going to be passed through to contracted providers to expand capacity in our region. And then, so you see the total budget here that includes the crisis centers, and then our FTE count as well. So our FTE count does drop down a little bit, and that is, I think, just fairly consistent with where the work is shifting right now. Some positions that we don't plan to refill, but some positions that we're adding in different areas. So it's just kind of a dynamic situation with the FTEs. But happy to answer any questions that you have on that. Wasn't planning to go through the whole page of explanation on the right, but I know last year the board, I think, had asked for this information at our first go-around, so we thought that was a good idea just to include at the front end this time and help explain some of those significant, where there's maybe pretty significant changes. So I'll move on to page 5, if okay with everybody. So page 5 is the changes in the county population and the property the net taxable market value for each county. And you can see there just the raw data and the changes in percent on population for each county. Adams County won this year in terms of percentage. Because they counted wrong, or are they counting wrong? Oh, the property values? Oh, yeah, because didn't they have this assessors, do something different? Yeah, I think I remember hearing that. Yep. Yeah. So I won't go into all that detail, but you have the data there, and then that's the data that helps inform the next page, page 6, which again will be either this one or whatever the board decides to direct us to put in. So this, and I won't go through it again because I already explained it, but this is how the formula works out for the counties and then how the county's contribution is determined. Page 7 is just a visual of how the health district is funded overall. So again, and this number for contracts funding usually, I would say, fluctuates around 50 to 55%. It's a little higher this year, and that's probably because of the crisis center funds, I would guess. Oh wait, they're not included in this. Yeah, so I'm not sure why, but they're a little bit higher this year. And the counties are contributing 27% of our budget. Overall, fee revenue makes up the next largest chunk, which is about 14% of our overall budget. And then we have some other small little slivers in there. Moving on to page 8 is just a summary of the board's the district's restricted and committed funds. And restricted funds are funds that we receive for specific purposes and can only be used for those. And this is when they cross fiscal years often, or they're like a very specific grant. So that's what you'll see in this restricted fund column. And then on the committed funds are funds that the board has committed for specific purposes. And so any funds that we have usually at the end of a fiscal year, we'll bring a recommendation to the board to consider on how those funds be used in the future. And for example, we can't levy any taxes on our own. So when we need like a new building, for example, or a large building improvement, we have to save for that. And so that's how these funds are used. For example, I was here, I think, maybe my second year when we had the 27th pay period, which happens every 11 years, and we weren't quite prepared for that, and so our board and I decided it might be good to kind of save for that, and when that comes up the next time, that there's some funding set aside to help pay for that extra pay period that occurs every 11 years. So that's just a couple of examples on how the board commits funds. And then the next few slides, which we just started developing these, so they may look fairly new to you, or you may remember them. But the first slide just depicts the change in population and the FTE, or full-time employees in the district over time, and we have 20 years, a little over 20 years worth of data available. Unfortunately, we didn't really keep track of FTEs. At least we couldn't find them in record prior to me starting here, so we don't have anything prior to 2017, but we'll have it going forward, hopefully. So, so you'll see that change on one side, and then the next slide shows, again, the population change and our budget requests from year to year, and we do have that data going back to 2002, thanks to Katrina, who went through a lot of old budget reports, or budget presentations. But I think that's helpful too, just to show that I feel like the board and the district have really tried to be responsible and not just, grow government, really tried to be conservative, and obviously costs go up and demands go up, and with population change. So I think that's a fairly consistent message that I get from these graphs. And then the last one is the budget to FTE count, and thought that might be helpful to see as well. Although there's, some weird things that COVID, I think, kind of did to those last few years in our picture there, and we don't have a lot of FTE history, but we will moving forward. So thought that would be helpful to see. And then the last page is just a recognition of our board members. And that is the end of the budget proposal. So I'm happy to take any questions that you have, or if you have feedback on how I can make this better, or make sure I address certain items maybe that you think your Board of Commissioners would be interested in hearing more about.
Action item. So now that we've looked at this budget proposal, we have two action items on the table. And one for the questions first off.
Just always like a little bit history. Do you have, what has been percentage increase you've asked for every last couple of years?
Troy? A graph we could throw in here too. We actually took it out because we used to, the board was really always interested in the history of what the state, when the state had an appropriation too. And so we would kind of track those. So we could add a graph back in there too for the historic.
It's interesting to look at these two graphs with just steady increase in population, and your budget is
a little bit all over.
2 or 3 year dips every time, it seems like.
Yeah.
Well, if you look at that, after the 2008, 2009, really, I was 2011 set on this board, and we were really trying to adjust to the economy that had happened, and really struggle. Everywhere went down, so pretty sharp B, I guess you up during that period of time, clear until probably 15 back up. He was very concerned about where the country was heading, and then very cautious. But I mean, I'm not very cautious on where we'll be going. We were on the upward trend, and COVID, I think, is going to be a lot because I think there's a lot of money thrown around.
COVID and inflation.
Yeah.
Commissioner Reby, I was pulling that little chart that Nikki had mentioned earlier, and historically, going back to, looks like this chart goes back to 2014. Historically, it's been a 3%, and back in those days with the state appropriation also in that mix, the challenge had always been that if we had a decrease in what the counties contributed, it would throw off the state appropriation. You'd kind of have this lag time, and so it was always that part of the equation was always a little bit dicey. So it stayed pretty historically pretty stable at 3% until we ran into 21. The board at that time was concerned. Obviously, COVID was kind of going, and there was some concern about what that would look like, so they dropped to 1.5%, and then because of House Bill 316, we dropped to 0%, and then back to 3%. Overall, the history has been board has been very conservative and watchful about those kind of patterns, particularly with the pretty static at 3%.
What's my feeling? We need to be really careful because all that federal money that came flowing in were all brand new printed dollars. It's going to catch up. We might still be growing, and but the cost of living is going to go up, and the money's not going to go as far. So I see us back right where we were in 2011 in about a year or so.
Chairman, this is Commissioner Haynes. I'd love to weigh in on this, but my county in particular is increased no matter what. So I feel kind of like Dr. Summers did earlier. Like, I don't know how fair it is for me to. I mean, I'd love to get the conversation going here amongst other counties, but no matter what we do, it's not hard for my commissioners to get on board, I guess is what I'm saying, because mine's red every percentage point. So for me, it's pretty good. Yeah. If you guys are feeling bad, I'm sorry, but for me, this one's pretty easy. So I'll sit this out unless called upon.
I'm actually pretty comfortable for the level of increase for our county too. So to me, it looks fine, but let Canyon County weigh in.
And it's based part of it, and then values are a part of it. So when property values go up, property values didn't go up. But values up. Our values double, and our values went way up. And
I got a question, Mr. Chairman. Going back to my comments about the 5%, not necessarily being just 5 flat for everybody. Maybe it's higher for those that are lower and lower percentage. for those that are at the top, just for giggles here, if this were like 0 or 1%, and the counties are only picking up compared to the 3%, I guess, increasing a total of $90-ish thousand of that. I mean, could you make the compensation plan work if you were at a lower than 3% overall increase to county contribution?
Commissioner Brooks, that's a great question. I think in reality, and I think part of the temper here is looking at the percentage of really what happens in the district based on what is provided by the county. So if we look at that overall increase, what we're doing across the district, only 27% of that winds up coming really, and it's difficult at this point to really peel out what exactly goes where, because when it comes in, it goes into the ginormous fund, and as we have different funding sources, it kind of peels out. But so if you're looking at that increase across the district of 5%, really 27% of it at maximum is really impacted by the counties. So I think from what, if I've gotten your question correctly, is it possible for us to enact the 5% if there was a 0 and that $1,000 wasn't there? Based on what I can see, yes, I think there would be an opportunity, but it would have to come somewhere, right? So we would have to literally reduce operating or positions. To Nikki's point, there may be some positions that we potentially hope to fill that we wouldn't. I hope that helps answer. I think that was the direction you were looking for.
Mr. Chairman, yeah, that's spot on, and I guess that's me asking a question as far as trying to give some guidance of what to be prepared for as well. Not necessarily like I'm going to ask the question, but somebody else might. So. Mr. Chairman, I'll also give some feedback here as well. Union County has 2 commissioners, myself and one other, that have not been through this process. So, Director, when you come present, it would probably be beneficial to have a little more detail, I guess, for us as far as like services provided, what percentage of the services overall, Canyon County residents receive. Probably the dummy 101 class with some details, 101 through 401, I guess, all in one package. Because I'm getting to know my fellow commissioners pretty well, and there probably will not be a shortage of questions.
Questions are good learning opportunities.
Chairman, Commissioner Haynes, I think, to piggyback on Zach's comments again, I think most of us have, you have a new commissioner, we have 1 new commissioner, you have 2 in Payette County, Jim County's got at least 1, so I think in general, it's probably this year in particular is probably a good time to do that, because you, across the board, have a lot of new commissioners in all of our district. Like I said, Payette and Canyon, of course, with the most. And Jennifer obviously she's here, so she's going to have a little more education than the other one, but probably a good idea just around the board is maybe schedule a little more time than normal, just because you probably are going to see some questions that you haven't seen in a few years with more experienced people on.
Mm-hmm. I would welcome questions over blank stares, for sure. But yeah, I do, and I appreciate it. The other thing I was going to mention is we do typically have fact sheets that we take out to the board for each county too, that we started doing a few years ago. So that will help part of your question or your feedback, Commissioner Brooks, is it does talk about, the impact the district attempts to make. It's always hard to put a dollar value on prevention, but we really try to talk about how we're engaged and how many people we serve and things like that.
Mr. Chairman, Director, we would be open to receiving those in advance and along with, you know, like the prevention programs, whatever, just kind of across the board information that included like what the program was, what the cost is, how many people, how many employees it takes kind of to run it,
How many it serves.
served, all of that. That would be extremely beneficial.
Right.
Yep.
Thank you.
Yeah, happy to do that. Thank you.
Word. At one time, period, or different parts of the environmental health, or where they would come in and do their own word. Or again, but maybe that's something we might. So, for board members, directly from those out there, Valley County have been all in our district. I've involved, so that's are here and what we're actually doing.
Yeah, and we do try to, like today, we had, I think, 3 presentations, informational, trying to help educate the board, but it's also hard, as, you know, looking at the time now, like, try to get those in and get the board business done too, so we try to be mindful of a good balance there, but, yeah, if you have specific requests or updates on things, otherwise we'll continue to try and squeeze those in too.
What I could have told you 3 what hours I could have told. Not even you know, close to the. I know you gave it to me, and it's sure you didn't think about it.
I would move that we approve this 2024 budget proposal.
I'll second.
We have a motion to approve the 2024 budget proposal and a second. And for discussion.
Is that with what specific increase for the counties?
We haven't done that yet.
Okay, that's on a separate.
That'll be the next one.
Okay, just want to make sure I had that straight.
Okay, well, we can do the.
I think it would be helpful to, yeah, I think it would be helpful to do 2 separate action items, that way it's clear.
I was planning on doing this 2
yeah.
separate, so we can do it, we already have a first and a second budget proposal back to the county.
Right, and whatever the vote is, then we'll just build that into the budget.
Yeah. So, it's been a motion and a second for the fiscal year 2024 budget proposal. Again, all those in favor?
Aye.
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 Any opposed? Hearing none. That motion carries. Now I need fiscal year 2024 county contributions.
Mr. Chairman, in the budget request sheet, I mean, that's what, am I looking at this incorrectly? Budget request, I mean, it refers to a 3% increase.
Then she'll have to, based on what we approve next, then she'll have to go in and change it.
Yep.
In fact, if we approve anything less than 3%, Nikki will have to go in there and adjust all that.
Gotcha.
Does that answer your?
Yep.
Okay.
Thank you.
Yeah, it'll just clear up. Well.
So I'll make the motion.
I just want to move forward.
Mr. Chairman, I move that we proceed with a 3% requested increase in the budget.
Second?
We've got a motion and a second.
So I would like to move to amend my motion that the 3% increase apply to the county contribution. Is that sufficient? You bet. My apologies.
Okay, we have an amendment, the original, with the second. I do the amendment first. All those in favor of the amendment?
Aye.
Aye.
Aye. Now with the overall proposal with county contributions, 3%. Are we with that one? We guess it's all in there, so it's all inclusive. Never mind. We're good. Thank you. Sorry. Okay. Third. Pages. Okay, now we're on to the next one. This is Nikki also, and it is another action item, and it's the fentanyl resolution review and approval. It's in your packet.
Thank you, Commissioner Abstary. I will try to go quick. In fact, I'm not going to read this to you, but the resolution, the last board meeting, actually, I don't know if Charlene, oh, she is here. Okay. I don't know if she wants to come up or not, if you have any questions, but we took the feedback on the fentanyl resolution and revised it and narrowed the focus. So it's now down to one page. And this is the draft that we also have shared with the other public health districts that they're running by their boards. But we wanted to bring it back here for approval of the board since you provided direction on and suggestions on how to improve it. So, for consideration and action.
Chairman, this is Commissioner Haynes. I like the simplification of it, and I do think it's important. I was talking to some fire and EMS people in our area of the world, and their experience is that outside of first responders, that the state is kind of pulling back their distribution of Narcan. So I think that this addresses that, and I think it's well done. So I'm in support of this.
I think that new legislation, I'm not sure, but it doesn't even provide Narcan to first responders. Is that right? Funding, it's not being provided anymore.
Oh, that's a good question. Charlene may know, but I believe the legislation was to restrict its distribution to first responders only, which it used to be that others could request it. And now it kind of puts the burden on first responders to manage it, which I don't think they really wanted to take on any more work. But it's just for that piece of funding. So if there are other funding sources, and like we decided to use opioid settlement funding, for example, to purchase, you wouldn't have that same restriction.
Dr. Summers, I would so move that we accept this. And just as a side note, I don't know if you saw in the news last night, there's a Caldwell police officer that had to be hospitalized because of fentanyl.
You made a motion to pass this, right? Second, I'll second that.
Okay, we had a motion and a second to approve the resolution to support the increase collaboration funding and access to life-saving tools to prevent and reduce fentanyl overdose and poisoning. Any other discussion? Hearing none, all those in favor?
Aye.
Aye.
Unanimous vote. Thank you very much. Now we're to the director's report, and I'll turn it back over to Nikki.
Thank you, Commissioner Epster, and I am going to zoom through these. So the first item I have on here is, mostly I feel like I should have let you know this ahead of time last month, although I think most of you knew it was coming. We had employed a contractor, Rathbone Falvey Research, to do an environmental scan of our region around opioid use, and we used our some of our first opioid settlement funds to do that, and the board and the district felt that, this was conversations we had, I think, late last summer, maybe early fall, to get an understanding of the issues, and then also like how the cities who received opioid funds and the counties who received opioid funds were planning to use their funding, with the goal being that the health district would use that information to help like support either efforts that are underway or fill gaps. So I know some of you and other partners in the community who were contacted by them were like, is this spam or a scam or phishing or something? And so, and I agree, I got the email too. So it's not. So if you get that request or if you haven't responded, please reply to them. It did seem like a big time commitment, I'll be honest, because I just went through that process with them. I think it was an hour interview, which seemed like a lot of time to give them, but it went by very fast, and it was actually, I think, really helpful for me to go through with them as well. So I just wanted to put that on your radar if you were wondering about why you were getting that, just as a reminder why that request was happening. So they'll put together a summary of their conversations and report and provide that back to us, and we'll bring that to the board probably with some kind of plan proposal on how to move forward with the opioid settlement funding that the health district is receiving directly. The next items here, I just wanted to remind you, these are mostly, I think, Katrina items that I'm carrying forward. We have, for the budget hearing coming up in May, we will need proxy forms for any of you who are not chairman of your boards of county commissioners, unless your board chair is planning to be here. So if your board chair is planning to be here, great, and if not, and they want you to be the proxy, then you'll need a proxy for that. Katrina will be sending them out, I think. Yeah. Katrina will be sending them out. We had Board of Health term expirations on here. That was just kind of a reminder, but we actually don't have any this year. Katrina just told me 2025. Yep, 2025. We'll have some. Yep. And then if you are not planning to attend the business meeting for the Idaho Association of District Boards of Health, and you would like to give your votes to another person who is attending, we will need a proxy for that. So Katrina will also be sending out those proxies. And there is a registration deadline for that conference if you intend to attend. That Katrina, when do you need those? Okay. She would like to know this week. Any questions? Well, I have.
Okay. Well, then, at this time, we have an executive session pursuant to Idaho Code 74206B and Idaho Code 74206. Motion?
I'll make a motion that we go into executive session per Idaho Code 74-206B and C.
Second?
Okay, it's been moved and seconded. We go into executive session under Idaho Code 74206B and C. Commissioner Purdy, how do you vote? Haynes?
Aye.
Dr. Summers?
Aye.
Commissioner Brooks?
Aye.
Commissioner Reeby? I vote aye. We are now in executive session. So anybody that, not a part of this, would you please leave the room? Thank you.
Everyone, that will be the end of it. They have ended the session after their executive session. We will not be returning to the room. Thank you.